I think that many of you would agree with me that life is a blessing. Life is wonderful. Every day we get an opportunity to meet new people, to try new foods, maybe to travel. Life is something great. But unfortunately, life is not always perfect. And tragically, many people die every year due to terminal illnesses. A terminal illness is defined as an advanced stage of a disease with an unfavorable prognosis and no known cure. This was Mosby's medical dictionary definition. Now, terminal disease can include certain cancers or heart disease, but many of us may not ever understand what it feels like to hear the news that you have a terminal disease and you may die in the next few months. So I would like to ask you for a second to think about the closest person to you, whether it be your best friend or your family member. Think about this person sitting in a doctor's office, receiving the news that he or she may not have but a few months to live because of a terminal disease. Think about the thoughts that may run through their mind or the facial expressions they have. And think about how you would feel. I'm sure that you would feel extremely devastated. I know I would. Terminal diseases are no joke. But there's a controversy going on when it comes to these types of diseases. People are choosing to do something that is very frightening, and it is physician-assisted suicide. Physician-assisted suicide is defined as suicide by a patient facilitated by means or information as a drug prescription or indication of the lethal dosage provided by a physician who is aware of how the patient intends to use such means or information. This is the medical definition. But in other words, a doctor helps a patient take his or her own life because they have only a few months to live because of a disease. It is a controversy because some people think it's humane. Some people think that people should have the right to take their own life and not suffer. But other people find it very immoral. Now, I have researched this subject and I have my own stance on it. And when I hear in the news of people who have done physician-assisted suicide, my heart breaks for them. Because it's difficult for anyone who has to go through this. So in this speech, I will attempt to persuade you why physician-assisted suicide is in fact immoral. And I have 3 main points. Though there are more points to be made, I have 3 major points that I think that are the main reasons why someone should not have a physician-assisted suicide. One being that doctors can misdiagnose. Another being that medical ethics and doctor-assisted suicide are not compatible. And also that we as humans are not given the authority, or we are not entitled to take our own life, because God is the one who is the giver and taker of life. So when we speak about doctor-assisted suicide, it is extremely important to note that doctors can misdiagnose, and it is something that happens all the time. It is important that you get second, third, fourth, more opinions than you can imagine, because this is dealing with your life, and you never know what the truth is. So here's a quote from David Newman Toker. He's an associate professor of neurology at Johns Hopkins School of Medicine. He has stated, misdiagnosis happens all the time. This is an enormous problem, the hidden part of the iceberg of medical errors that dwarfs other kinds of mistakes. Vermont Alliance for Ethical Healthcare also states, legislation to legalize physician-assisted suicide, S77, requires that a patient has a diagnosis of less than 6 months to live. Despite advances by modern medical science, misdiagnosis is still fairly common. Patients can be misdiagnosed as having terminal illnesses, and prognosis for life expectancy can be wrong by months or decades. The National Center for Policy Analysis also addresses this subject, and they say an estimated 10 to 20% of cases are misdiagnosed, which exceeds drug errors and surgery on the wrong patient or body part, both of which receive considerably more attention. So what does this mean? Sometimes doctors can misdiagnose, and if you receive their diagnosis and you decide to get doctor-assisted suicide, and then come to find out you didn't have a terminal disease at all, you basically just cheated yourself out of a longer life. Along with misdiagnosis, it is against medical ethics. Medical ethics concerns with the moral conduct and principles involved in the medicine profession. The American Medical Association, which was founded in 1847, has stated, "It is understandable, though tragic, that some patients in extreme duress, such as those suffering from a terminal, painful, debilitating illness, may come to decide that death is preferable to life. However, allowing physicians to participate in assisted suicide would cause more harm than good. Physician-assisted suicide is fundamentally incompatible with the physician's role as healer, would be difficult or impossible to control, and would pose serious societal risks." The thing that stands out to me most is the part of the quote that says, "Physician-assisted suicide is fundamentally incompatible with a physician's role as a healer." Other than misdiagnosis and the fact that it contradicts medical ethics, there is a question of who has authority to take one's life. Now, those who are in favor of physician-assisted suicide have another name for it. It's called death with dignity. And there are several definitions floating around of what this actually means. But one of the main definitions found is best described in Christian C. Equimadu's master's thesis. And it says, "One should be allowed his own choices when facing his own death. He should have the opportunity to individualize the circumstances of his death and die on his own terms." So someone who wants to die with dignity wants the choice to be in control of their life. They also want respect. They want people to respect their decision. They want self-respect. They find it as respecting themselves when they don't make them suffer through a disease like this. And they also want to maintain pride. When they think that they have control over their fate, and they see that the illness is not in control, they maintain pride. But the truth is that God, He is in control. He is the one who created us. He is the owner of our lives. And you can take that or leave that. But we have no authority over when we die. He's the only one. Job in the Bible, he was a very wealthy man, but he was a devout Christian. He loved the Lord so much, and he was tested. And his property and his children all were taken from him. And he said, "Naked I came from my mother's womb, and naked shall I return there. The Lord gave, and the Lord has taken away. Blessed be the name of the Lord." So now that I have made my case against physician-assisted suicide, I will close. Physician-assisted suicide is when a doctor helps a patient in their life because they only have probably about 6 months to live. But we have seen that doctors can misdiagnose and that it is against medical ethics. And then also we don't have authority over when we are to die. It is God's job to have authority over that. So my plea is that you please listen to what I have said if you are undecided, and take my words to heart, because instead of encouraging someone to take their life because of a very difficult situation, we can be there to encourage them till the last day of their life.